Oh,
Hello.
hello. How's it going, Chris?
Hello.
Wow, finally nice to
I
nice
know.
connection
Yeah.
here. How's it going?
Doing well. How are you?
Oh, good. Thanks for asking.
There you
Hey,
go.
dude.
Hello.
What
How's
up?
the family?
Thank you
Alrighty.
Hey, good to see y'all.
so much both for being here.
Yeah.
Yeah, thanks for organizing this.
Of course. Thank you. And you're both from the West Coast, so I can imagine how sunny it is there earlier. It was like 30 or 40 degrees earlier, so not too fun being here on the East Coast.
Today was super sunny at night, to be honest.
Okay, don't brag. Yeah, it's cold here. We're in Seattle right now.
Yeah, is it cold?
Yeah, heard Cali's like pretty nice right now, so send
Pretty
some of that
nice.
sunshine over.
It brought us all together. If you could first please introduce yourself.
Hello, everyone. My name is Tate Masunaga. I'm originally from Hawaii, but living in Seattle. I've been practicing dentistry for about 4 years out of dental school. Did a residency AGD in Washington, loved it, and I've just been in the mainland ever since.
Yay! Well, Hawaii. I went there back in March or April, and I don't know how you left. When I was there, me and my friends were like, we're gonna stay here forever. But was it at like a different place, Seattle and Hawaii?
Oh, very different. Hawaii was it's an incredible place to grow up. It's warm and it's always sunny, and you got the beaches everywhere. The people are incredible. It's a very aloha spirit. It's a culture of acceptance and love. So that was like, it's a mixing pot of everything. So, and it made me who I am today. Seattle also is similar. It's just you got the four seasons there, and you can just keep driving on a road without running into an ocean, which is nice. Drive up north, you're in Vancouver, Canada, and then south, and you're in Portland, Oregon. So yeah, I love it here a lot.
Yeah, what we noticed was everyone in Hawaii was like so nice. I wanted to set up the lives because I think it's so interesting to like learn about different professions, especially within the healthcare field. And I feel like it's so encouraging to hear the journey it took to get there. And I know, for example, dentists, there's so many questions about how to get to that point. You know, it's like such a long road because it's a doctorate degree, and then you're practicing afterwards, you have your own practice. And I think we could start with you is what were your inspirations for going into dentistry? Like, did you always want to do this when you were a kid, or was there a family member who's a dentist or a friend?
Yeah, so I have about 13 people in my family who are either dentists or dental specialists there. So my dad and my grandfather were both orthodontists. So I got a lot of family members in it. And then I just happened to like work with my hands a lot. I love the people interaction. But before dentistry, I was interested in architecture or even marine biology. But I ended up going with dentistry because I guess as I got older and I started shadowing more, then it got more interesting. And yeah, it just seemed to work.
Awesome, yeah. So I'll tell you guys my story. I went to UCLA kind of knowing that I was interested in science and health in general, but I didn't exactly know what I wanted to do. Coming in, I just assumed that I wanted to be a doctor because that's just kind of what made sense for me to go into. And my first couple quarters at UCLA, I tanked. I basically struggled super hard. I came in, probably had too much fun, and found myself in a tough spot because I was like, if this goes on, I don't think I can be a doctor. So I went ahead and really thought about like, okay, so if I really want to become one, like, what do I have to do, right? What path should I take? And honestly, that kind of led me down looking at different options as well. So I took a look at other health professions. I mean, I'll be honest with you, I looked first at dentistry and other health professions because my GPA wasn't that great, but I don't regret it at all because that's kind of the starting point that helped me to look at other things, right? Without that, I don't think I would have. If I didn't have that impetus to make me explore, I don't think I would have looked at other options. I probably would have kind of tunnel visioned myself. So in a way, I consider it a blessing. Not a great one, but it is what it is, right? And so ended up looking at different health professions, looked at dentistry, and it wasn't until I went on a mission trip to Vietnam. It was with a group called Memo, where we kind of volunteered. I did some volunteering both in dentistry and pharmacy and a bunch of different health professions. And overall, dentistry was just the most fun. I had a mentor there who kind of taught me more about what it is. And from there, just kind of ran with it. I studied hard and ended up getting in. And that was pretty much my start.
Nice.
Yeah, thank you guys.
Can you explain to people who may not know, like, what's the road to becoming a dentist, like academic wise? Basically, like kind of like medical school, right? Where it's 4 years of undergrad, and then you apply to a dental program? And is it also 4 years for the doctor?
Yeah, so like if you want to go into dental school, there's not really like a major that like they say you need to be this major. They just have like a bunch of prerequisite classes that you need to pass. So physics, chemistry, biology to this number, maybe a certain math this number. And as long as your major satisfies them, that's all they need. Grades need to be decent, and you have to take this test called the DAT, score out of 30. And I think yeah. So it's kind of like the MCAT.
What's the score out of for DSC?
It's out of
It's 30.
Wow.
It's 30.
Okay. Okay, Dr. Say. Okay.
Oh no! Wait. Oh, you're asking what was my score?
Yeah.
Oh, not 30. Sorry, I thought you were asking what the score.
I was not 30
No,
either.
I was not 30. I was not 30. I think I got a 20, which is.
I thought you were saying, oh, I got a 30, and I was like, wait, how much is that? 30?
No, I would not. No, I have never met somebody who got a 30.
We did not score 30. I
Yeah,
think we did
so
well.
I misheard
Did you do
that.
pretty well on it, Tate?
Yeah, I think I got a 20, so which is like I think what they want there. But I've
Yeah.
seen people get in with 19s and even 18s as well. So, but that 20ish range is kind of like you kind of want to shoot for that.
For sure, yeah. I studied hard for it. I probably took a whole summer. Like, I was at UCLA during that time, but I basically had that summer just to focus on it and a little bit of work on the side. I mean, at that point, I kind of had the luxury of time, but some people don't. They have to, like, study for it while they're in school and stuff, which is pretty tough. I would recommend if you can take the time to do it by itself.
And what's the DHC? Is it like just the sciences and math and stuff like that?
Yeah, so there's different subjects, but it takes basic science first. So it's bio, chem, OChem, and then there's also a math and reading section.
Mhm.
But the most interesting one is called the PAT, which is a perceptual ability test. Basically, it's a test of your perceptual ability, I suppose. It has some really interesting and not strange, but interesting questions that kind of test how you're able to see and think about 3D objects or 2D objects and compare that, because these are really important skills that dentists need to have.
Got it. But I think that's a part that's very unique because I don't think other standardized entrance exams have that.
Yeah, because dentistry is a very, number one, perceptual, and number two, like, hands-on field. So having those skills are really necessary for you to succeed as a dentist, and it's actually something that weeds out people who don't have that, I guess. Yeah, it's kind of interesting, and it's very unique to dentistry.
Are all those 4 years like didactics? They're all academic, or is it a rotation?
I guess it depends on the school you go to. So for OHSU, 4 years, the first year was almost just strictly academics, strictly classes. Maybe you would go to a clinic here and there just to learn the tools and watch like the upperclassmen do it. Second year, they'll ease you in and maybe have you do a cleaning here and there. And then the last 2 years of dental school, like you're actually seeing patients, and it becomes less and less classes. But so they kind of ease you into it. But I know some schools that just throw you right in. So, but yeah, Kevin, what was your experience?
Yeah, I mean, we went to the same school, so kind of the same thing, basically. First 2 years, we practice on plastic teeth, plastic models, and at the same time do our didactics. And then third and fourth year, after that, we jump over to the other side of the school where the clinic is, and you start to work on real patients. You typically will kind of ease into things with like easy fillings, some cleanings, things like that. But eventually, you really want to build up and focus on more involved treatments, basically.
Got it. And so after those 40, you graduate with your doctorate, and there were questions that were, is there a difference between a DMD and a DD degree? They're both dental degrees, and I think you know what's the difference between the two.
DDS is Doctor of Dental Surgery, and then DMD is Doctor of Dental Medicine. They're basically the same thing. It's just different titles. I'm trying to like wrap my head around the history of it. Kevin, can you explain it better?
So I don't know. However, I do know that they are entirely equivalent, and you should not feel any different about going to one or the other, because the functions of either degree are exactly the same. It's just that some schools offer one or the other.
Yeah. So I guess it's kind of MD and DO thing, right? Where
Exactly.
Yeah, they're exactly the same. I guess it just depends on like which flash or which letters do you want behind your name. Is it like, do you want Pokemon red version or blue version? I guess that's my best analogy I can think of off the top of my head. It's the same
See,
thing.
but red version and blue version are different, though.
Yeah,
DMD and
it's the
DDS
same
are
game
not.
though. It's just like maybe different. It's just a different color, and you have a different starter, and then you just have a different fling at the end.
It's different.
But-
Because in Pokemon Red and Blue, you can't get the same Pokemon.
Yeah, so then like you have to like buy another cartridge and trade with your friends and stuff.
Exactly.
But
So it's different.
but
But
DDS,
DDS and DMT are exactly the same.
yeah. So that's the
How?
only
Okay.
yeah.
Okay. So,
So, but it's the same
but
thing. It's like the same game. It's just
yeah, I'm kidding.
whatever is cooler.
I'm kidding. But yes, you're right. Exactly. Yeah.
I love
But DO and MD are actually slightly different in their philosophies. I believe they have the exact same function though and scope. However, I believe from my understanding that their philosophy of treatment is different, whereas DDS and DMD do not have a difference at all.
exactly the same thing.
Yeah.
Got it. Well, either DD or DMD, it's like such a long road to get there, and I can imagine only the amount of sacrifices you had to make to get there, right? It's a lot of time. I can imagine like how many parties you had no to because you had to study or you had class.
We went to plenty of parties.
Well, Kevin, and I can imagine the amount of which is so true for a lot of the amount of student that was.
Oh yeah. Oh yeah.
Can you like explain those sacrifices that you have to make? And I think the line of thinking you made that you decided on that it was okay for you to make just to get to where you.
Yeah, so yeah, it just the amount of sacrifices you had to do. For me, like when I went to college, I always pictured college as like being like the how I saw in the movies and stuff like that, where it's like, hey, we're going to parties and we're actually doing fun stuff there too. But no, it was all this work and studies. I was not one of those people who could do both. I just had to like just really lock down for it. So I mean, yeah, I went to one here and there and stuff like that, but yeah, it just you kind of had to just like if you had a bunch of science classes, you had to get a certain grade. You just had to just lock down for that. So just sacrificing a lot like the pleasures to get to down just to get in, only to sacrifice more. That's kind of like the path that you have to choose. Some people can do both, but I was not one of those. So, well, yeah,
Haven't
that's me.
be able to do both.
Well, okay, so I'll tell you guys my perspective. Like I said, when I went to UCLA, honestly, I got smacked my first 2 quarters. Like things were hard, and I wasn't prepared for like. And by the way, UCLA was my undergrad, so when I went there, I got smacked, and I wasn't prepared really for how hard I had to study for things. And it wasn't until third or fourth year of undergrad that I met a close friend, and he wanted to be a doctor. So he told me that if he wanted to really turn things around, just like me, like both of us did, that we would go and study together every single day after school. And we'll take some time. It doesn't matter always how long. Maybe sometimes it's short, but we just have to make it a habit to go and do that every single day. And so I said, yeah, let's do it. And literally we did that. Like after we got home, we would just pack our stuff and then go study. And we just made it a habit to do that unless something was going on. But otherwise we would go. It wasn't until I made that habit that I really started to do better in school. And I ended up doing a lot better my second 2 years at UCLA than my first year. So that basically built the foundation for me to get into dental school. I would say in dental school, from my experience, the didactics were easier in dental school than they were at UCLA. But the trouble was more so with like time management because we had a lot of projects going on. The didactics themselves were easier, so I felt like I didn't have to study as hard to do well that way. But more so, I felt like just balancing all of the projects they would throw at us, going to sim clinic, and I wasn't like a natural like clinician to start, so I had to do a lot more practice than other people. I felt like, but just like anything, you get a lot better with time, practice, repetition, time, and especially dentistry is like something that comes with experience and repetition. So, yeah, that was my experience. You
And,
get a lot better with practice.
and how long have you both been practicing as dentists now?
Yeah, I'm fresh. I graduated last May, so my time has been about a year and a half almost now.
Nice.
How about you, Tate?
About 3 years out of resident or 4 years out of dental school. Graduated 2017, 18 did an HE residency. So 3 years out of without and like actually legit practicing without like any grades or supervision. So
Mhm.
Where'd you go to ATD?
I did at Health Point in Tequila. It's like the community health. So kind of started
Nice.
my journey in community health, and then I decided I want to try private practice. So and I've just been I don't own a clinic, but I work at private practices as an associate dentist. So the benefit of that is you just show up to work, you do dentistry, you do your notes, and then you go home and you don't have to worry about managing employees and stuff like that. So
For sure.
Yeah, and how does life look right after? Like, is there resident, or is it something that you can choose to if you wanted to?
Dentistry kind of gives you options. If you would like, you can go out and go straight to work, which is pretty much what I did. At this stage, a lot of people may choose to go into further education, which may include either a 1 year residency, 2 year residency, or even 3 and 4 if you're going into like a specialty. So the 1 and 2 year residencies are typically for general dentistry. So you'll go deeper into like subjects within general dentistry. And if you're going into a specialty of a specific topic, like braces, like endodontics, which is root canals, or oral surgery, there's others. If you want to delve deeper into like singular subjects, then you'll go on for like 3 or 4 or even 6 years.
Hmm.
It's all optional though.
Got it. Yeah, because a lot of people were asking, and even I was asking too before. Wait, what's an endodontist? What's an orthodontist? What's a,
Yeah.
what's all these dentists? Are they all? Because I had two root canals in the past. One of them got infected before, and then dentist was like, "Oh, you have to go to
To the endodontist. And
dentist."
you're like, what the hell is that?
When I went to that dentist, they were like, "Oh, you got to now go to the other dentist." I was like, "What if it? What all these?"
it's like the endless chain, right?
Yeah, it's an endless change. So it's basically there are specialties within dentistry as well, right? But for both, it's general dentistry, like what you're practicing right now.
Oh,
Both.
I'm just doing GP or general dentistry.
Same,
Yeah.
yeah.
Do you think there's those top three, like going to work today, you'll be like, oh, for sure, I'll see 3 things. What are those most common things that you see in a general day for general dentistry?
So the bread and butter dentistry.
Yeah.
So the bread and butter is just regular tooth fillings or composites, crowns, extractions, and then cleanings, or what we call prophies and SRPs, or scaling with cleanings, which is like deep cleanings. So if you have stuff trapped underneath your gum, then we have to go and dig for it.
Yeah, exactly. Like the majority of your day consists of seeing patients, looking for what they need. You know, most of the time with patients, they don't even know what they need or if they have problems. And I'll tell you a story. Basically, I had not a lot of sympathy for patients who walk around with a mouthful of cavities for a long time. Like, I wondered how people could walk around and have a bunch of cavities in their mouth and not come in and get them handled. Until one day I went to visit my dentist, which is my uncle. I got some x-rays and I realized that I had a huge cavity sitting within my tooth. And honestly, when I looked at it, I had my eyes blown up because I was like, I had no idea that was there. And it didn't hurt. I didn't feel it. And honestly, the experience getting it like cleaned out, putting an onlay on, which is like a porcelain filling, was not fun at all. And so since that experience, I've had a lot more sympathy for number one patients who don't, you know, don't come in and get their teeth proactively fixed. And also just for like the patient experience, which I realize is just not fun, you know? Like coming to us is not a whole lot of fun. So it's our jobs to make people feel as comfortable.
Yeah. And I feel like on those bread and butter, like filling or teeth cleaning, I feel like there's some dentists who don't understand the magnitude, the gravity of the great work that they do. Like a person's smile can mean the whole world.
Oh, hell yeah.
I had a patient before who had both her front missing, and even when she talks to me, even if it's just the two of us in the room, like I cover it with, and I was
Yeah.
like, you should smile more, and she was like, oh, I have no,
Like I can't.
Mhm.
you know, and your roles as dentist is not only to like physically fill those empty spots in their mouth, but like you feel that confidence, you know, that you try to restore that smile that people try to hide. And with that being said, I can imagine how rewarding it is, right? As some dentists, for you, do you have like additional things that you think are the most rewarding aspects of being a
Yeah, I guess for me, like what makes it rewarding is seeing like that, like kind of how I explained it, where like you have a patient, let's say she's missing a tooth or just unhappy with her smile. It's not just the teeth there. It's not just like, oh, I can't chew. It's like this is kind of like my self esteem here and kind of my self identity. So to like kind of watch somebody transform when like they see like, wow, I never even knew I could even have that smile. They become a completely different person. So they'll start going out with friends. They'll start to do things, take care of themselves even more. Yeah, so it's like there's a huge psychological aspect of it too. That's that will just encourage them to just live life more. So to kind of like see that impact is like what makes dentistry worth it to me.
Yeah.
Definitely. Yeah. They have a concept called emotional dentistry, which is essentially dentistry that plays to people's emotions and impacts them beyond it impacts them emotionally basically is what it is, right? And within emotional dentistry you have things like replacement of teeth. That's a very emotional moment for you and your patient, right? And you have things like aesthetics, stuff that people can feel more confident about. You can collaborate with them. You have things like big health issues, stuff like pain, right, is a huge emotional part of dentistry. I mean, there's many others, but I think those are really where the satisfaction of dentistry lie. It's stuff where you can make an emotional impact on people and tap into that and make them feel more confident, make them feel better, make them feel good about being there with you. And I think that's where really like it makes me and all dentists. I feel like that's what really makes it worth it.
Yeah, I can imagine. And I want to tie that back then to where we talked about all the sacrifices that you made thus far. Is it worth it? At this point in time, everything that you've been through?
Absolutely, it's absolutely worth it. I'm still trying to think of the words right now. Kevin, you want to take over? Let me think of my answer.
Yeah, so I'll say this, like it depends on the person. Okay, so for me personally, I truly actually enjoy dentistry a lot. Like I really, number one, enjoy being around people. Like I like talking to people, and that's a big part of being a dentist, right? It's just like or any service job, which dentistry is essentially a service job, right? Being a dentist involves you being a customer service rep to your patient and fixing problems. So for me it's a lot of fun, but I know people who have gone through dentist school and honestly don't enjoy dentistry.
Mm.
And for them I honestly have heard that I've heard regrets, like people say that they have regretted going to dental and becoming a dentist and going through this entire process and they don't find that it's worth it. So I can't say that it's all rosy and say that, oh yeah, like it's the great job and you'll love it by the end of it, right? Because the truth is that I know people who don't love it, who don't enjoy doing it. And I will say for myself, I really do enjoy doing it and it's rewarding for me, but I can't say to everyone that it would be. That's just the honest truth.
Yeah.
Yeah, and then building on top of what Kevin was saying is that like dentistry is very rewarding though, but there's a lot of other ways that you can get from it too. So, but this is why like shadowing and making into dental offices and just making sure that this is the right path for you. Because like there's other ways, there's so many paths that you can take in your career, but yeah, so like yeah, just I say just take your time before you choose this path.
I agree with the shadowing part, and I think that's so important because I feel like in every field, especially in healthcare, right? Like I've been working in the hospital for the past years, and you see new grads really don't want to be there. They have no idea what they got themselves into because clinical during a school program is different from when you're actually working the you're working your
It really is, yeah.
you're working in your own time, not being super buddy. That's why shadowing is so important because that's how you know that the lifestyle, what the lifestyle you're trying to get. I come from a teaching hospital, so I see medical, I see nursing, I see residents, interns, and it's so obvious. One of them don't even want to touch it. They don't even want to go to the patient's room. So, what would be your biggest advice for us to pursue this field of dentistry, whether it's pre-dental or a dental student? So,
I would say, I said this to somebody who asked me like what they should do in general, right? Like somebody who was kind of like looking at different paths. And I would say like there are so many doors and paths that you can take out there, right? There's literally infinite doors that you can take out. And the only way to really understand what the outcomes may be is to try your best to look like behind that, like each of those doors and those doors that you're interested in, right? And so if you're interested in one path like dentistry, then you have to try your best to look behind that door and see what is behind it, right? And that includes shadowing, trying it out, talking to people who are in it, and just trying to see what it is behind that door before you try to open that door, right? Because if you try to open that door without understanding what's behind it, then you may be wasting your time. You might find that you put a lot of effort and energy to open that door and you don't enjoy what's behind it, right? So that's kind of like an analogy that I like to give to people. The more you can see behind each door, the better off you'll be when trying to decide which one you really want to, you know, put effort into opening.
And I also wanted to add, I think this question will have a lot of bearing more on Tate, I guess, because it started even before the pandemic, right? And then Kevin started right during the pandemic.
Like right into the pandemic.
Yeah, right pandemic. But also ask you both, as the pandemic, do you think changed dentistry? Because what I was thinking, well, actually, my root canal got infected. That's when the pandemic was starting, and it was like so bad here in New York, and I was having like pus on my gum, and I was like, oh my gosh, it's an emergency. I need to find a dentist, and it was a dentist because everyone is closed, and we know that COVID is like respiratory droplets and in the nose, in the mouth, which is which is your epicenter of expertise. How did that change dentistry, and how not just the practice itself, but also the whole mentality behind it? Like, I'm gonna go into a patient's room and I'm gonna be opening up the mouth, and there's COVID everywhere.
Yeah, I remember when COVID first hit the country. So in Washington, we got all dentists pretty much just got shut down. Like there was a mandate went out says sorry, and dentists can't we until we figure out what's going on. Like we have only like emergencies only, which means like unless it's tooth pain or like swelling there. Like we had to, and then plus all the PPE was going to the front line at the time. So for me, I lost my work hours, and then like during that time we didn't know what this virus was and how it was spreading, but and we're wondering, okay, are our current face masks even going to save us from this? So like it was a mad dash to find all these alternatives to like for face masks. So N95 we were low in it, so then we thought of ways to like put a 3D mask over your face to make it air suction there. We couldn't shake hands anymore. The way we had to greet patients, we had to shoot one of those temperature things at their heads, then mark and document everything there. So definitely a lot of protocol changes, and also like made us evaluate how do we greet patients. I'm a very huggy. We're all very shake hands and huggy people, but to find other ways to like kind of like to kind of like rearrange that to find a new normal of how we interact with people was a big change for sure. We've always been pretty good on cross contamination control, but mostly that's the social aspects where it changed.
When we found out that spread through respiratory droplets and was confirmed that it can be air, was there fear involved though? Because saliva is basically what you'll see all the time, right? Was there fear? Oh my gosh, I'm gonna contract the virus because that's what I'm exposed to.
Oh yeah, absolutely. I think I remember I was on Instagram, and then there's a story that said like, oh, dentists rank up highest on the list for getting like contaminated with COVID and spreading. I'm like,
You're like, great.
yeah. So I was like, okay, well, and then hygienists too. So I remember like, yeah, it just the whole profession just got we got creamed.
Kevin, you entered the workforce at the wrong time.
I know.
Yeah, Kevin.
It was strange, yeah.
I can't imagine. I mean, I'm sure you didn't imagine like being in that school and the pandemic comes in. How was your experience? It's like a newly minted dentist, and here's here's the virus for you.
Yeah, so for me, it hit back in March. So I was actually still in school. Like I wasn't out of school yet by the time it hit. And when it did hit, it ended up basically canceling clinic. So we were in clinic at that time. So everything stopped for a while. The school was just trying to figure out what to do. So we had a lot of like online lectures for the meantime. And by towards the end of school, we started to come in a little bit, but really we ended up graduating without finishing the majority of our cases, if that makes like we didn't get to wrap up the majority of things that we were supposed to do. So as things went on, we graduated in the midst of a pandemic, didn't have a real graduation, ended up doing an online one. Couldn't work because we weren't licensed as dentists yet. And as we didn't get our certifications through REB, which is like the exam that we have to take to get certified. So we ended up waiting a few months till we could understand what we were supposed to do. The school arranged for us to end up taking it in Loma Linda, at Loma Linda University instead of at our school, which normally take place. And that was because our school was in LA County while Loma was in a different county. Ended up taking it there, and we couldn't work all the way up until about September of last year. So there was a big gap. It was about maybe 5 or so months that we basically couldn't do anything.
Mm-hmm.
And that was a strange time, but looking back, it was kind of a nice break, I guess, during the midst of basically lockdown.
Yeah.
Yeah, that was like the lockdown time. So it's not like I don't know, dentistry was in a weird state at that point, anyways. So to be real, it was kind of a good time for me to hunker down and just stay at home. And just
Yeah.
like everybody else, we were trying to figure out what was going on, how to relive our lives in a post-COVID world.
I-
So yeah, I would say I had a similar experience to most people.
yeah. No, like during those times, I was like, "Where are the dentists?" Because
Uh,
we to the dentist, and then she told me to go to an orthodontist or one of the dentists again. And I was like, nobody's open though. Like, I make a Zoom call via ZocDoc with the dentist. It's just like, oh yeah, I'm on the West Coast. Gotta wait for like 3. Oh my gosh. And so she prescribed antibiotics. So the whole telemedicine really going on for time, but I'm glad it got resolved. When I started promoting my life, people were sending me with questions because I've always wanted just a dentist. A common question that we're asked is cavities. What causes cavities, and are they really bad if you don't get filled?
Absolutely. Absolutely. Like there's this cavities are there's actually a lot of things that cause cavities there, but basically it's just the main thing that causes cavities is the acidity of your mouth, or the pH. Then multiple things can cause this. So the most often one is like when, sugar from food gets eaten by the bacteria, which you call strep mutans, and then it gets converted to acid, which lowers your
Mhm.
acidity. Or acidic drinks and other things like that can like lower the strength of the enamel as well. So that's one for starts.
Yeah, there's so many things that cause cavities. Well, another one that eventually can cause like essentially when your enamel, which is like the hard outer shell of the tooth, is compromised, that always puts your tooth at risk for cavities, right? So even your tooth being rough or in areas where maybe it was worn away in an unnatural way, those areas are also more prone to cavities than others, right? Saliva is a huge thing that contributes to cavities if it's not sufficient, right? So saliva is a big thing because it has natural buffers within it, so it keeps the pH of your teeth healthy. If you don't have saliva, if your mouth is dry, whether it's due to medications, there's conditions, health conditions that cause your saliva to dry up, that's a huge thing that causes cavities as well.
Yeah. Oh, one more actually, and this was an interesting one. It can be abrasivity of a toothpaste actually. So like a certain toothpaste will have these things called RDAs, or like relative dentin abrasiveness. So some teeth, like you'll see this in charcoal and the whitenings, where it's like they try to put these particles where it's like they say, oh, if you brush really well with this, it'll like clean your teeth off, like or wipe off your stains, but you're actually brushing away the enamel, which is the whole protective thing of the tooth there. So not saying
Yeah.
that toothache by itself will cause cavities, but it can lower the strength of it, which can make you more prone to getting cavities. So interesting little finding.
The second part of your question was, is it important for us to get them addressed, right? Like, is it really bad if we don't get them addressed? So I have a friend who's in residency right now, and he told me a story of a patient who came in for infective endocarditis, which is basically a heart condition, right? Where an infection has taken over and infected areas of the heart. And upon examination, that infection actually started within their mouth. So that infection started from a cavity, which grew large enough to infect the nerve of that tooth, which traveled down into the roots of the tooth, into the bone of the tooth that's holding the tooth, right? And that infection got large enough that the bacteria from it was able to spread down into the rest of their body, essentially. It becomes a systemic infection, right? Because the mouth and the oral cavity is a very vascular place. Like a lot of blood and vessels is running through your head and your jaw, right? So there's nituses for bacteria to enter and basically infect other areas of your body. So all of that is to say that's a very scary case because that patient ended up needing valve surgery, valve replacement surgeries, which obviously is incredibly invasive, incredibly expensive, and life altering, right? That's an extreme case, but it's something that happens, you know? It happens when people are not aware of their dental condition. And ever since my friend told me that story, I have taken more pride in doing the simple things in dentistry, like a simple filling, right? It doesn't seem like a lot to me because it's literally what we do all the time, every day. But in a way, it's preventative dentistry, and that's preventing that ultimate outcome, which is could be a heart infection.
Funny is I work in cardiac surgery, and
Right, yeah,
one of my patients on Saturday had infective endocarditis because
yeah.
of cavities.
Because of the tooth infection.
Yeah,
There you go. That's
it's so
exactly
funny.
what we're talking about.
So infective endocarditis, we literally saw vegetation of bacteria all across the heart, and usually things that can cause infective endocarditis is severe trauma to the chest, like physical trauma to the chest, sometimes illicit drugs, and sometimes cavities.
Sometimes tooth infection, yeah, oral
And
infection.
Yep, it's all related.
I wanted to touch upon that charcoal paste. I think it's been around for a while. So as the actual expert of the teeth and the gum, is it a yay or a nay for you? Would you your patients?
I would not. My favorite analogy that I think of charcoal toothpaste is let's say you have a Mercedes and then you want to polish it. You polish it with sandpaper. That's kind of what you're doing to your tooth.
Yeah.
So you're just grinding but I mean the thought process for someone who does it's it would sound like it would make sense. Like, oh, if you take away all the stained part, it would remove it there. But remove it too much though, you're gonna go yellow, which is the soft under area of the tooth there. So yeah, so eventually you would just wear it down where there's no more white to even remove. And then that's when you get yellow teeth and sensitive teeth and decay. So
Yeah. Essentially, from what I've seen, yeah, it has abrasive particles in it that are more effective at removing stains. So you'll probably see results if you have staining on your teeth, and it actually probably will make it whiter because it's literally taking off, like sanding off part of your tooth. But over time, just like he was talking about, that actually causes damage to your teeth, and it's something that I think in moderation could be effective just for whitening, but I wouldn't do it more than a little bit, if that makes sense.
Got it. But now that talking about yellow teeth, that's a question that a lot of people ask: is are yellow normal? Because I know Tate was how it was right. It could be the actual kind of inner part of the teeth, but is yellow teeth ever normal though? Is that the baseline of a human teeth?
it's Kind of hard to answer that one because like it just depends on like it could depend on a lot of things like the age of the patient, what
Mm.
caused in the first place, and just like the genetics. Like was the patient like born with a lot of like like thin enamel, or was something discolor it there? So I wouldn't. It's kind of hard to say whether it's normal or abnormal though, because teeth
Mm.
aren't naturally white. They're actually a lot of colors. They're amber. They're blue in
Mm.
it. So yeah, I'd say like I had to take a look at some photos there, but I can't. Even I don't know how to answer that. Kevin, what do you got?
Yeah, I would say that's pretty much what I would say too.
Mm.
Normal is very subjective, right? Because normal for 60-year-old is very different than normal for like 10-year-old, or normal for someone in Switzerland is very different than someone in, I don't know, Japan or something like that, right? So I would say everyone's baseline is different, but at some point, pathologic, which is like pathologic yellowness, it happens in people for various reasons, right?
Mm.
It's present for many reasons. Like he was talking about, it could be natural staining from things that we eat, or it could be due to thin enamel, because underneath your enamel, there's yellow dentin, right? There's so many reasons why, but ultimately, whitening could be an effective treatment for most people, and some people not.
Mhm. So, is there a brand, not fun, is there a brand of whatever paste or whitening that you would personally recommend to your patients that you think are actually uh, not just safe but actually effective?
I'll say just in general, rather than a brand, my favorite whitening is just in-office whitening. And the reason why is it's fast. Like people can enjoy their results just like in front of me, in front of them, and it's typically like a 2-hour session. You come
Mhm.
in, we set you up, 1 hour's worth of whitening essentially, like 4 sessions of 15 minutes, and then we break it down, and it's an awesome experience for patients because, like I was talking about, it's like emotional dentistry, right? It invokes emotion in them, and for them to be able to see it in real time, it's just a really cool experience for people, right? For them to be able to see, oh, we started with this shape, and we'll show it to them. We'll take a look, show it in the mirror. Oh, where are we right now? And then after an hour session, where do we end up? And to see them actually look at it and say, oh shoot, that made a huge difference. Like I think it's just an experience that people should have. Although at home whitening works really well, it's something that takes a lot longer,
Without
like that you
strip
might not know.
or
Yeah, strips work. Yeah, strips definitely work. But if you're not careful with it, it can kind of get onto your gums and it can be sensitive at times.
and for gums, how sensitive are the gums? A few people have asked how much bleeding from the gums is concerning and would warrant someone to be like, oh, I need to go to the dentist.
Hard to answer though, but just like whenever there's gums that are bleeding though, it's just an indication that there's inflammation that's causing it. So whether it's like your systemic health, your medications, you're pregnant, or if you're mouth breathing and just straight on just oral hygiene, that can cause bleeding there. So, but preferably you want to like make sure your gums are in good health and your teeth are in good health before you go for whitening. That's why there's like a little meme or joke of people of like patients like, oh, I just want whitening when there's a lot of oral health needs addressing there. So I would definitely recommend getting your gingival health under order before going for whitening. Otherwise, we won't have any teeth to whiten.
Hmm.
So,
But there was a question, which is very interesting. I didn't start receiving them until today. I received 20 of these questions. It is the same exact question. And in the hindsight, I understand, I feel like what people kept from asking it until the day of. So there was a viral TikTok a few months ago, where a dentist is saying that they can tell if their patient um has had oral sex, and Kevin's like, had oral sex. How true is that viral?
actually, oh man, yeah, here I have the answer for that. Just wait right here. I'm going deep for this one here. Okay.
Literally like 20 or 25 people ask this, like
That's a lot. That's a
five.
lot. Okay.
I think they held off until we were starting.
No, I'm gonna be honest. I have no idea. Like, I've never looked for that, and I don't even know what I would look for if I were looking for that. So I'll pass it on to Tate. He seems to have an answer for this.
Yeah, so starts with a P, but like yeah, so basically what it is, like, yeah, I mean, I don't know who even like came like would just I don't know what kind of person would just went to every single patient, made a scientific study, looked in back and looked for like red dots in the back of the throat.
Had a shade.
But yeah, anyways, yeah, there is an actual legit like finding where it's like, yes, you could assume that somebody was doing it if they were, let's say, like had something in the back of their throat. But I mean, I don't judge. I mean, I'm not looking in the back of the throat and saying, oh, you had a hot dog or something, or you know, it's a to me the whole concept is like I'm not even gonna question that. Like if I see something suspicious, refer to oral surgeon. I'm not gonna. But who's gonna biopsy that? You know.
Yeah, because I feel like the comment on that viral TikTok was like, "Oh my god, so my dentist has been judging me this whole time. This whole time, my dentist knew."
Well, they
Yeah,
don't teach us that in school, so I don't know if I would look for that.
I know.
Maybe if they did, if that was part of a lecture or something,
Yeah,
it'll make people listen more. Yeah.
the
No, for real. I feel like if they taught us that in school, it could be helpful because that's part of pathology, right? That's part of oral path. And unfortunately, they didn't bring it up, so I don't know how to answer that question.
got it. Hey, like he's studying. He's like,
Yeah,
Yeah,
he's
I'm
looking
determined to
like,
find this because I know the TikTok you're talking about, and I remember like seeing that. Like I remember just going through my old pathology books, like, oh, this was on a TikTok. So,
yeah, because I had viral TikTok and then a video response to it, which I think someone asked their mom, who's a dental hygienist. He confirmed it too. So I was like, well, I guess it's real.
hang on, I'll get this.
Oh my
I'm
gosh,
not just in here to get this.
Tate is determined to educate us today about, as Kevin said.
Oh, petechia, petechia, yeah, petechia, yes.
Yeah,
yeah, okay.
that's
Yeah,
right.
Because
it's,
particularly there's so many reasons they could be there. It's not like exclusive to oral sex.
Yeah.
Yeah, so I don't. To be honest, I don't even know why it's even in the textbook. It's like they should just say it's like they say like, hey, if you see something like this, if you see this dot, it just means that some physical object just caused disruption in the underlying
Exactly, yeah.
like
It doesn't
capillaries and stuff
necessarily
like that.
mean
So
that.
it's like, and then whose business is it to know like what you've done there?
Yeah.
You know.
It could be something else. It
Right?
could be I don't know, you stick your finger there
Yeah,
all the time.
maybe I
You
was
keep
like
like
trying to dig for a
poking.
tonsil stone back there. You know.
Yeah,
I was like,
some people
you know.
like to like I don't know, like touch
Oh my
it.
gosh,
It could be anything.
yeah, I saw the videos about the stones. And would you also extract that as well? Or
We'll refer that.
oh,
Yeah, if it's like a
I
big
would
one, it requires like an incision though. I refer that one there, but I've seen some people like get like a stick and then like fish it out there. I don't do as a procedure that I charge for, or even have competence say let's remove it all. But if it's staying like there, you could reach it. Then yeah, use a Q stick. Be careful, but nothing I even would do.
well, thank you so much for answering the questions that were submitted. I think the last question I want to ask both of you, for sure your job is so stressful and quite stressful because you're in charge of this person's health, right? And their well-being. How do you compress out of work? Like after that's done, what how do you relax from work?
Oh, music festivals.
Me too.
Yeah,
To be honest,
DC
yeah.
Las Vegas, Ultra Miami.
I'll
Yeah.
be there. Yeah.
Yeah,
Yeah. I mean, like, I think for both of us, I don't know, I don't want to speak for you, but like, music is a big part of my life. Like, I played piano since I was like 7 years old. Grew up from like classical music into a multitude of genres. But yeah, I would say I'm pretty diverse as far as what I listen to. But for both of us, I would say EDM is probably like our favorite thing. Like I like being within it. I like listening to it. I like talking about it. I like making it. I like listening to it. I don't know. Probably same for you, yeah?
Oh, yeah, absolutely.
Yeah.
See, I didn't get into EDM music festivals until dental school. Like, I was very sheltered growing up, and in Hawaii, I didn't know who Dylan Francis was or whatever. I knew Zed, but I didn't even know those festivals existed. But yeah, live music, it's you need to have some sort of like release. Like a lot of people, like I used to think that I could be the type to just go and just hammer through everything, not take breaks and stuff like that. But I don't know, just it changed my life, and it's I don't know. It's a way for you also to make friends outside your profession too. So that's another benefit of
Oh
going
yeah.
out, getting out there.
Yeah. I found patience going out. Just like literally in a crowd, I'll talk to like random people, and I'm sure you have too. Yeah, I saw your reel. Same
Oh,
thing. Yeah,
really? Oh, yeah.
yeah.
No,
I saw one where you like talk to like people and made them your patient. Same thing. Like I'll go out and just like start conversations with like random people and tell them I'm a dentist, and I've had them literally come to me and become my patient. So it's a cool like space just
Amazing.
to like see and meet people, and I don't know. I find it fun.
Yeah.
Yeah. Well, also like the comments I received from it got reshared on the iHeart Raves page, and then I was reading and I was like, part of me was actually really freaked out. I was like, oh great, I didn't expect this to get reshared, and I was afraid I was gonna get like shunned by society, like, oh, there's a dentist who raves. But the reception was actually quite positive. Like, hey, look, it's very humanizing to see a doctor doing that there. And a lot of dental students and even dentists reach out saying, oh my god, thank you so much for doing that there. Like, because going out having fun is somewhat stigmatized, for us
Mm.
professionals. But they said that to know that we're out there in the community makes us even more trustworthy. And
Yeah.
I even got some stories of of other dentists going out to music festivals finding patients, and one of them even did a third molar extraction on the patient, and then at the race, like, hey, how's your tooth doing? And did the exam there. So a lot of crazy stories there. But I gotta say that it's honestly just be human. Go live your life. There's more life than just school and being at the
Yeah.
dentist too.
Yeah.
It's funny because every dentist that I know loves music festivals. Is this like a requirement as the
Oh,
DAT?
there's a huge community of just healthcare providers, tons of nurses actually, a lot too. So Chris,
Oh,
I'm surprised. Like, when were you gonna go to your first festival?
Look, I've never been to a music festival, but I am ready. I'm gonna go with both of you. So,
All right,
mm,
Kevin, we
we
gotta
can
we
hang.
gotta
Let's
we
go.
gotta we gotta we gotta take this guy out, man.
well, I'm gonna see Tate in like what? I'm gonna be in Seattle in 3 weeks, right? In 2 weeks.
Yeah,
So,
yeah. Not sure what
oh,
I'm not sure what big if there's a usually on weekends there's like some sort of artist who's coming though. It won't be like a
yeah.
big event or rave or something, but
Well,
I'd
the two
say
of you can introduce me to a music festival one day. And we'll be we'll be
yes.
planning.
Fun.
Kevin, what festival should we take Chris to?
We're gonna go big for our first one. Yeah.
Which
I don't
one?
know if you can handle.
Oh, you can handle. But Chris, you're in East Coast, right?
Yeah.
Okay, so here's some suggestions I have that are on the East Coast there. Zoo, that's in I think that's in New York, right?
I'm not sure. I've heard Izu since forever, but um, I've never been. So what's up? You
Okay.
can't handle. I can't handle it.
Oh, you can handle it. Just if you can stay up like all those late nights of seeing patients and studying for OChem, you can survive a night of a music
That's
festival.
true.
You just
That's true.
gotta just dive right in, man. And
Well, I
I
can't.
even have nurse friends who even like take you on your first one.
Oh my gosh! Someone said he's out of the club. Get out of here. That's not true.
All right.
Well, it has been so fun, and I can't wait until we go to the festival. Well, my first music festival with both of you. And thank you so much for being been so fun. I learned a lot. And everyone, please have these filled. And don't worry, one's judging you, even if you've been doing the got 3000, whatever they call it. Thank you so much for joining.
Okay, thank
Yeah,
you.
thank you so much
Bye.
for organizing this,
Catch you
Chris.
guys later.
Bye bye.
All right. Have a good night.
Bye.